Ottawa South.
Mr. Speaker, Canadians can't get over the fact that they are increasingly frustrated by this government's incompetence in this healthcare crisis. Why, when faced with this crisis, has the Prime Minister reacted by shrugging his shoulders and forsaking the entire world and Canada's isotope industry, to completely fail to live up to his responsibilities?
Thank you, Mr. Speaker. Mr. Speaker, in 2008, AECL made the decision to discontinue the Maples 1 and Maples 2 reactors, which was to supply medical isotopes to the world. And it was after 12 years, over $500 million, and not one single medical isotope produced. As a result of that as well, the government instructed AECL to indeed extend the license of the NRU as best it could in order to continue to produce medical isotopes. Along with that, Mr. Speaker, we have struck last week an expert panel to review other options that may be made available, and that's indeed what we're doing.
The
Honourable Member for Ottawa South.
Speaker, 1/3 of all hospital patients in this country rely on nuclear medicine. In January, senior officials warned the minister that disease trends, the health needs of our aging population, and the lack of effective alternatives will drive up the future demand for medical isotopes. Conservatives refused to convene an international panel to reassess the Maples reactors, even though they renewed the Maples license in 2007 because they do produce isotopes. Some experts, in fact, believe options exist that could see the Maples online in as little as 2 months. Why not?
The Honourable Minister of Natural Resources.
Well, Mr. Speaker, I thank the honourable member for his question, but after reading his statements in committee and after hearing him today, I can tell you that he's incorrect on the facts. The reality is, Mr. Speaker, an expert panel and experts did review the Maples in 2003, and that's exactly at the point in time when the Liberals were in government. That's when the member from St. Paul was the Minister of Health, Minister of State for Public Health, and would have been made aware of the issues surrounding the Maples and the decisions that would be going forward. But indeed, Mr. Speaker, the most important thing for Canadians to understand is that all avenues were exhausted with respect to coming to the decision to discontinue the Maples.
Honourable Member for Ottawa South.
Tell that to the patients who are waiting for their cancer test, Minister. Look them in the eye and tell them that. The World Health Organization has declared the global H1N1 outbreak a pandemic. This is the first global flu epidemic in 41 years. Since May, Manitoba has repeatedly offered its help to plan for a possible pandemic in Aboriginal communities. This government did not step up to respond. With lives already lost, what concrete plan does the government have to prepare all Aboriginal communities for this global pandemic, and why has there been such a delay in response?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, 2007, we've developed a pandemic plan for this country, and we are implementing and working with that plan, which includes First Nations communities. As for Manitoba, I have an excellent working relationship with the Minister of Health in Manitoba. We are in constant communication with the communities impacted and assisting them with additional resources as necessary as we deal with the situation. Thank you, Mr. Speaker.
The Honourable Member for